In America, when there's an emergency, and the police show up, and the firefighters ride in, and the paramedics arrive, only one of these emergency services sends you a bill. Isn't that odd? I mean, that's not how it works in other developed countries. We live in the richest country in the world, yet we're one of the only few countries not to guarantee healthcare as a right. My name is Hadi Rahim. When I was growing up, I remember everyone around me, including me, believing that America was number one. And in many ways we are. But I thought that also included our healthcare system. However, several years ago I had an experience that opened me up to a different sort of thinking. When I was about 9 years old, I woke up in the middle of the night with a pain in my lower stomach. It got to the point where I couldn't fall asleep or even sit down. So my mom panicked and called the ambulance. And when the paramedics arrived, they examined my pain and thought I had appendicitis. My mom never ended up putting me on the hospital for fear of a high bill. So she elected to drive me to the emergency room instead, where I spent hours taking various tests. Long story short, turns out all I had was a stomach bug. When I threw up in the hospital, the pain went away. Now, a false alarm in a medical situation is usually a good thing, but it wasn't such great news for my parents, who were charged with a bill of $2,000, and we had insurance. Looking back on that experience today, I realized that we live in a healthcare system that punishes people for playing it safe, for taking care of themselves. Our healthcare system disincentivizes healthcare. It's not just me. According to a survey by the Commonwealth Fund, 46% of Americans have said that they've had to delay their own healthcare because of the cost. Half of Americans have said that they wouldn't be able to afford a surprise $1,000 medical bill. But this isn't the only problem with our healthcare system. Roughly 26 million Americans are uninsured. Millions more are underinsured. Healthcare keeps getting more expensive, even if you do have insurance. Medical bills are the #1 reason for bankruptcy in the United States. 1 million diabetics have reported rationing their insulin because of the cost. Worst of all, tens of thousands of Americans die every year because they cannot afford healthcare. Now, people say in response to this, well, Hadi, that's the price we pay for having the best healthcare system in the world. Free healthcare in these other countries will inevitably lead to a decline in quality, to wait times, to national bankruptcy. But that's not even true. We spend about 18% of our GDP on healthcare. That's more than double other high-income nations. But that higher spending isn't leading to better outcomes. A study from the Commonwealth Fund analyzed the healthcare systems of 11 industrialized nations. It found that overall, the US ranks 11th out of 11 in healthcare. It found that we had the worst administrative efficiency of the 11 countries, the worst health equity, the worst access to care, and the worst health outcomes. And every country that ranked better than the US had a universal healthcare system. These countries have higher life expectancies. They have lower infant mortality. They have better health outcomes. So looking at all of this, what if we did have a system that treated healthcare as a right? What would that look like? Well, there are different types of free healthcare. Some systems have more government involvement than others, but they all share one basic principle. Healthcare is a human right. Everyone will pay for it, and everyone will benefit from it. What does that mean? Well, the first thing it means is that there are next to no out-of-pocket costs. Healthcare is free at the point of service. When Americans go to the doctor, they don't have to worry about a bill at the end of it. They simply have to focus on getting better. No more GoFundMe pages to pay for healthcare, which, yes, are a real thing. Think about the millions of Americans who will no longer have to choose between rent or medical bills. Think about how that would stimulate the economy. Money that used to be going to healthcare could now go to paying for groceries, to raising kids, to paying tuition. People could also demand higher salaries from their employer, who would no longer be paying for their health insurance. People like to talk about how private insurance gives Americans more choice and more freedom, that a universal healthcare system would get rid of people's freedom in healthcare. But is that really true? Are you really free if you're tethered with medical debt? Cost is the biggest restriction on freedom in this country. Those with more money have a greater ability to pursue happiness than those without. Universal healthcare will give all Americans more freedom by eliminating the worry of a surprise medical bills. But it's not just peace of mind. Universal healthcare would save lives. A study from epidemiologists at Yale found that universal healthcare would save 68,000 lives every single year. No one would ever have to die because they were too poor. Now, this system has a lot of critics, and there are many legitimate concerns people have if we were to adopt such a system. The first concern is quality, which I've already addressed. Plenty of countries have universal health care, and they do better than us in many ways. Another concern, however, is cost. People say that we wouldn't be able to afford such a system. But my response to that is that our current system is actually more expensive. Plenty of studies have shown that universal health care would actually save money. Healthcare spending as a nation would go down. Dozens of studies, like one from the University of Massachusetts Amherst, the Mercatus Center, the Yale study cited earlier, all show a net savings of around a few billion dollars to trillions of dollars over a decade. Why? Well, one of the reasons for these savings is lower drug costs. We pay outrageous sums for drug costs in this country compared to our peer countries. But the biggest reason for these savings is that, believe it or not, leaving healthcare to the government is actually more efficient. Since everyone would be getting their care paid through for the same source, the government, the payment side and administrative costs of healthcare are actually less because the system is more streamlined. We see this in the real world with our current government-run Medicare program, which spends 2% of its budget on administrative costs, compared to insurance companies, which spend about 12 to 15% of their budget on administrative costs. So this idea that we wouldn't be able to afford it is just not true. Another concern is wait times. And yes, countries with universal health care have longer wait times. But think to why that is. They have longer wait times because the people in those countries are actually getting care because now they can afford it. We pay for our shorter wait times with more death. Every country rations healthcare. It's just that some ration it based off of need, and others, like ours, ration it based off of your ability to pay. I'd much rather live in a system where the people who get treated first are those who actually need it, not those who have the biggest wallets. Another concern is choice. People say that universal healthcare would get rid of Americans' choice in their healthcare, but that's not necessarily true. Plenty of Americans will still get to choose their doctor, their clinic, and the hospital that they go to. In fact, it would actually give them more choice in those things because plenty of people get denied coverage from their doctor or their hospital because it's out of their insurance network. But in this case, everyone would be covered by the government, so there wouldn't be that type of network system. It would also give people more choice in switching jobs, since half of Americans get their insurance from their employer. Another concern people have is that, or something that they say, is that you can't compare countries with universal healthcare to the US for many reasons. One reason is that they say that these countries are much smaller than us, to which that I respond with Canada. They're larger than us if you didn't know, and they also have a universal healthcare system, and the Commonwealth Fund showed that their system ranks better than ours. Another concern that people have is that these countries have a very small population, to which that I respond Germany and Japan. It's possible to have a large population and a universal healthcare system. These systems scale. Another thing people say is that, oh, well, the reason why it works in those countries is because the people in those countries, they live healthier lifestyles, and there's less income and wealth inequality. Well, maybe that's a consequence of having universal health care, not a prerequisite. Now, I know a lot of people are thinking, why can't the free market fix these problems? Why can't the market work with healthcare the same way it works with everything else? Furniture, cars, clothing. And the reason for that is because, unlike those things, healthcare is not a commodity. A lot of the attributes that make the free market work there don't exist in healthcare. The market relies on people comparing prices, going to different stores, looking at different products. But you can't do that when you're dying. When you dial 911, you usually just get sent service from the nearest hospital. Just like how you get sent fire service from the nearest fire station, or police service from the nearest police station. It just doesn't apply. Also, you don't have the ability to say no to an outrageous price. Let's say I charged you $10,000 for this painting I did when I was 12 of the binary sunset scene from Star Wars: A New Hope. I know it looks like the Starry Night. Now, if I charged you $10,000, no one would rightfully take that offer. But if you do, please hit me up after this talk, because I'm trying to sell it. But what if instead I charged you $10,000 for a life-saving drug? Well, everyone would pay for it, because how much would you be willing to pay before you'd rather just die? Debt's always better than death. And this is why hospitals can get away with charging people tens of thousands of dollars for life-saving medical care. Why drug companies can get away with charging people $100 for a vial of insulin here, while up north in Canada, that same vial of insulin costs just $12. Why? Well, because the Canadians have figured out, just like the British, just like the Australians, just like people in New Zealand, or just like people in Norway and Sweden and Germany and France and all these other countries, that healthcare is a right and people should be guaranteed to it. Now look, universal healthcare is far from perfect, but if we took in the time and effort to design it in the US, we could make our system truly the best in the world. This isn't a partisan issue. In other countries, parties from both the left and the right support this. In 2019, the UK Conservative Party ran on a platform of, hey, we need to get Brexit done so we could spend more money on our NHS. The Conservative Party of the UK ran on funding the national healthcare system. This isn't a partisan issue. It's an American issue. As Americans, we tend to live in our own bubble. We think we're number one, and so we don't look at the ideas and successes of other countries all over the world. And that arrogance is our biggest weakness. So let's have an open mind. Let's treat healthcare as a right. Thank you.